Now, when a patient comes to see you with a nasal problem, what's involved in the evaluation? Because obviously many of these symptoms can be a little similar initially.
Yeah, so initially we take our own history. We figure out what the primary complaint is. Two people with the same condition might have a very different complaint. Some might say, hey, I can't breathe through my nose. The other might say, I have a very runny nose. And so these are different things that you would target treatment-wise. What we do is take a full history. We then do an exam. And as an otolaryngologist, we very often incorporate endoscopy into our exam. That's when we actually look inside the nose and throat to figure out where the problem is.
And you did bring a prop, and you're going to show us what a nasal endoscopy is.
Yes. So this here is an example of one of our endoscopes.
Don't be scared, everyone. He is going to demonstrate, and that is not all going into your nose, correct?
Correct. Yeah. Most people are terrified when we bring this into the room, but luckily the fiber optic component of this doesn't enter the nose completely. Okay. You only need a small length of it, probably about that long, to actually visualize the entire nasal cavity. And when doing the exam, we actually have control of the fiber optic tip, so you can you can maneuver it around the anatomic structures, avoid contact, and a successful endoscopy shouldn't be painful at all.
Okay, so this is not going to hurt.
No, it's usually described as a little strange, can be described as uncomfortable. We provide topical nasal sprays, but if done appropriately and maneuvered correctly, it shouldn't be painful.
Now, when you insert that, what are you looking for now?
So we look through the scope, visualizing the nasal cavity, and basically look for an explanation for the patient's complaint.
Okay.
Whether it's an anatomic narrowing, whether or not there's an active infection, basically something treatable to resolve their symptoms.